Hi, my name is Dr. Letizia De Mori and I'm a neuropsychologist and I work to private therapy clinic as a psychologist and neuropsychologist. Today I would like to introduce a specific service that we provide at private therapy clinic. I would like to talk about cognitive rehabilitation. They are specific rehabilitation for brain after injuries, damage, hemorrhagia, but also for disorder like ADHD, psychosis, learning difficulties, learning disability. So the aim of the rehabilitation is to improve the general functionality of the brain, including the IQ. The cognitive rehabilitation could be provided to everybody. Of course, there is a minimal age to begin with, so it's better to provide this service from early age, about 5 years old, and because sometimes they need to read some topics, some words. But except this, it's possible to provide this service to all population. The first step before to begin with the rehabilitation is to proceed with a specific assessment, because the rehabilitation are focused on the specific functionality that is not working in the brain. So, for example, working memory or attention, like ADHD, or in brain damage. So, we need to understand exactly which area, which abilities, which functionality we need to improve. For that reason, it's important to proceed as first step with a specific assessment to investigate, for example, the disorder or the damage. It is very useful to have an MRI in case of brain damage or any other brain disorder that we discover. Starting from the data from the assessment, it's possible to proceed setting the platform. In this way, the platform will start from the bottom level. And during the different session, the platform are very modulated. I mean, when someone will take the exercise for a specific brain area, for example, working memory, the platform will increase the level and the complexity of the exercise based on the previous results. So it's easy to understand is in brain damage case, the brain is not always modulated due to damage. So in this way, the platform will increase or reduce very slowly the complexity, the level, follow the needs of the client. The rehabilitation programs, the cognitive program, it's tailor-made. So it's not possible to say and decide how many sessions the client needs and for how long, because every person needs different improvement, different exercises. And of course, there are two different main aspects. If we are talking about brain damage, brain injury, the exercises and the plans are completely different, because the sessions are 1 hour and at least for 2 times a week. Why? Because the brain needs time to work, needs time to recover, needs time to begin, need time to do everything. It's like when you don't have one arm, for example, and you do physiotherapy to improve other parts of the body. The same with the brain. When we have a damage, it's not visible, like the arm, but the brain needs the same time of speed, the same time of recovery. It is not possible to increase the complexity of the exercise because the brain is not ready and needs time to improve and recover and follow the program. If we are not talking about brain injury, everything is easier because the brain is safe, is healthy, and we need to improve some weakness points, like, as I said, in ADHD, working memory, for example, is not working properly, or attention, focus attention, concentration, they are not working properly. In this case, we don't have a damage, so that means the connection are very fast, they are working, and in this way, the session is 2 hours long, just one session, 2 hours long, and in this session, it's easier to improve the exercise, the complexity in real time, in that moment, because the brain is ready as you go to the gym with both arms. You can increase the complexity of the exercise because you need a different time of recover, a different time to do different exercise. So every exercise is tailor-made, and every rehabilitation is tailor-made. So as I said, it's not possible to decide the first day how many sessions and how long it will be, because everything is subjective and depends on how the brain respond to the treatment. The rehabilitation program could be made even face-to-face or remotely online. The best is always face-to-face. Why? Because I will be there, I will be with the client, the psychologist, the neuropsychologist will be with the client, and is easier, it's better for us to see the improvement in that specific moment. So we will understand how to increase the exercise in that specific moment and for the next program. Online, it's fine, but it takes longer because we need to analyze every result for every exercises. So we need to find every single data to improve and follow the level of the platform, even if the platform increase the level by itself, but we need to follow how the platform is going. So would be better face to face. Without brain damage, the results are strong and stable because the brain is healthy. So what we do, we create new connection and we improve the speed of the existing net of neurotransmission. So the improvement are very strong, and the general functionality of the brain is very improved in terms of different brain area and IQ, the level of the IQ. If we are talking about brain injury, it's something different, because when we have a damage in the brain, it's like to have a hole. It's not really a hole, but we have a hole in terms of connection, because over there the connection are dead. So we need to create little bridges to cover the brain. So that takes a long time, needs longer time and session. So that means we are going to build bridges to cover the hole, and in this way the result take longer but stay stable, very stable. And of course the speed is little different because it's not the connection, the previous connection of the whole. It's a new way, a new highway that the transmission need to find, but it's stable too. The cognitive rehabilitation has a strong impact with other type of treatment and rehabilitation. So for example, if we are going to increase and improve the attention, because we need to improve that specific component of the brain, the attention will be very helpful, for example, for physiotherapy or for occupational therapy, because the patient, the client is more focused, the span of the attention is longer. So in this way, he can or she can, they can do the exercise more focused with a better results at the end of the program. If we are working without brain injury, the sessions are structured in specific stages, if we can call like this. So the sessions is divided in steps. So is a mix of using the program, the software, mixed with pen and paper exercises. So in this way, it's possible to increase the level from different aspects, from different point of view. So for example, if we are talking about dyslexia, so it's a learning difficulties, we know that in learning difficulties, for example, working memory and attention and visual spatial and coordination is not working properly. So the session is divided in different parts for attention, for working memory, for visual spatial, for coordination. So even if we mixed with the software and the pen and paper exercises, it's very fluid, it's very modulated, and sometimes it's nice, is something very fun to do it. So that makes the session and the rehabilitation something that increase also the motivation to continue and improve the abilities and the functionality. So when we do and we program the session of the new rehabilitation, we need to take in consideration what we are doing and for which part of the brain and which client we have in front of us. Because with children, the session must be more funny, more excited. If we are doing something with adults, will be funny too, will be nice too, but more intense, because the adult can be very focused, very adequate, and more strong in terms of brain functionality. If you need more information, or if you want to try just one trial session, you can contact private therapy clinic and ask for cognitive rehabilitation, neuro rehab for brain injuries, or about your needs. Feel free to contact us.